have the pleasure right now, today, at this moment, to interview Tom Biggs, who I'm just excited to talk to, and start out with a basic set of questions, which are very easy. Please state your full name and date of birth.
My full name is Thomas Morgan Biggs, and I was born on the 11th of March in 1933 in Houston, Texas.
Okay. Your parents' names?
My mother was Ruth Morgan. Her last name was Morgan. My father's name was Thomas Morgan Biggs. So we had the name Morgan in both sides of the family.
Okay. Any relation to medicine? What did they do?
Well, my mother's father was a family doctor. And I think that was the foundation of my medicine, because we were there always for Thanksgiving and Easter and so forth. And big dinner. My grandmother cooked on the wood-burning stove. But never was a meal finished without someone coming and knocking on the door with a problem. And he would respond by saying, come see me tomorrow, or wait about a half an hour and I'll be with you, or let's go immediately to my office. And that inspired me, or at least it stimulated my thinking about what is this? And that's really why I became a doctor, because it was trust that brought these people to him. And he would do what he could do and to enable to make their life better. And I thought, what a wonderful thing to do. And I guess I was 7, 8 years old, however old young people are when they start thinking that way. But it was my grandfather, my mother's father, who stimulated me to become a physician.
Okay.
And I never thought of anything else.
We all have similar stories.
Yeah.
We were focused at an early age. Goal-oriented is the word.
Absolutely.
Was your mother a stay-at-home mom, or?
My mother was a stay-at-home mom. In those days, most every mom was a stay-at-home
Right.
mom. It was unusual for women to work, but she was a stay-at-home mom, yes.
Now, you were born in Texas?
I was born in Houston.
Okay. You spent your whole life there.
Well, I went away to college for a little bit. I went away to intern in Madison, Wisconsin 1 year, and I went away to the Air Force for 2 years.
Okay.
So
you would go to college, undergraduate up in Wisconsin?
No, I was a surgical intern at Wisconsin in Madison.
Okay.
But I went to college, went to 1 year to Yale, and I came back home and went 2 years to Rice and got in medical school early.
Okay. Now, how many children, grandchildren,
I've got 5 children, and I've got 4 grandchildren, and they're all alive and well and functioning and making contributions in some sort.
Okay.
My baby girl is at this very moment in Lebanon/Iraq doing documentaries of problems that they're having there. So it's rather exciting for the family.
Okay. Now, how did you meet your wife?
Well, I was happily married, and my wife was a surgical resident in 1988, and soon thereafter my wife decided she didn't want to be married anymore and left. And so subsequently, a couple of years later, this surgical resident called and later knocked on my door and gave me a bottle of champagne, and she said, "You gave me this bottle 2 years ago." I put it in my refrigerator.
Wow. And
so we began chatting, and then subsequently 4 years later we got married. So we've been married nearly 25 years.
Wonderful. Okay. Okay, now what inspired you to go into plastic surgery and the mentors that you have?
Well, it was interesting. As a surgical intern in Wisconsin, I rotated on several surgical services, and general surgery, neurosurgery, and so forth. And neurosurgery had a mortality rate of about 50% to be admitted to the service because it was a university hospital. But the plastic surgery intrigued me. Now, we were doing no aesthetic surgery, but it was really quite creative. And this grandmother that I told you a little earlier was an artist, and was a prolific artist with a lot of paintings. But I didn't have that. I never did anything. I never drew a picture. I never made model airplanes. I never did anything. But all of a sudden, I got into this plastic surgery thing, and it was a creative effort that went back and found some gene way back in the back of my brain and kind of perked it up. And I thought, wow, that's really the thing to do. Of course, I had to go through general surgery to get to plastic surgery.
You've seen momentous paradigm shifts in plastic surgery during your illustrious career. And I just tell us a little bit about them, and we talked earlier about some of the things.
There have been paradigm shifts, and they've all been really great contributions to our underlying purpose to make people's lives better. But the first one that I was associated with was the breast implant, because I was a resident with Tom Cronin, and was side by side with him. I didn't contribute much. I was a great retractor holder and an IV starter and so forth, but I was there, and that was the breast implant, the silicone gel breast implant. We did the very first one in 1962, Houston, Texas, and that started something really quite big. And so the breast implant was a paradigm change for the tools that a plastic surgeon had to deal with the problems that he or she had.
I got to interrupt you real quick, because Mel Spira told the story that Frank Giroux had his hand on an IV bag of blood and said, "This feels like a breast."
That's exactly true. That was a very true story. It was not only it was warm also, and he was walking down the hall and said, "This feels like a breast." Of course, Frank was 28 years old, and it was 2 o'clock in the morning, and that was the day that they stopped putting liquids in glass bottles and began putting liquids in plastic bags.
Thank you.
That was the significant point. And so Cronin comes around a day or so later on making rounds and sees this plastic bag hanging from the IV stand. And what is this? And Frank explained it to him. And he recalled that he had had a conversation with one of his previous residents in New Orleans at American Society of Plastic Surgery meeting that was held there a few weeks, 2 weeks earlier. And this resident of his said that there's a company in my town that's has a new product, and it's a terrific thing. You can make it into various densities, a solid, liquid, or gel, and it can be used in all sorts of purposes, has very little body reaction. So Cronin then put these two together and called Dow Corning. Would you think about making a breast implant?
Wow. Yeah.
So they did. They sent us a tiny little prototype, and we put it on a dog. And the dog's name was Esmeralda, and the dog did okay, and that was it. We were off.
And the rest is history as we know it.
Yeah. And the very first case we did was a woman who had a lot of tattoos on her breast, and they represented a former love affair that she'd had, and she wanted to get rid of that guy. So we took those tattoos off with a Paget dermatome, and then she became the very first patient. And I saw her just about 3 months ago. Wow. And she said that she wanted to have those implants out. I said, okay. In my mind, I kept thinking, boy, these implant companies would love to be a part of that. And then she said, but I want smaller ones in, and I want a better shape. Of course, she's 83 years old. And so we sort of semi-scheduled her for surgery, but then she called later and said she had a problem with her knee, and when that got well, she'd do it. Hadn't happened yet.
Yeah. Well, it's an amazing journey, that part of it.
It has. We've gone through
all
so
of America
many changes.
thanks you.
I liken this to the airplane. The Wright brothers airplane used lift and thrust and got us off the ground. And that flew just for a few minutes. And we went from the Wright brothers airplane, and now we have the 787, and we have the F-16 and the F-35. Fantastic. But they've gone through an evolutionary change, step by step by step. And that's where we've gone with breast implant. Okay.
And I want you to talk, because I had the privilege of running into you at the Texas Society meeting when you presented you fell in love again with your fat. And boy, that's, you got to talk about that. I don't have a great knowledge per se. I can see the results you got. Yeah. But for Dupuytren's, the stem cell concept, and Dr. Curry, if you would talk about that, because we're right on the cusp there.
Well, that's so exciting, the fact that you remembered that.
I love the results.
The topic of that talk is a love affair with plastic surgery. Right. Well, yeah, I have fallen in love again with plastic surgery. I've fallen in love many times with plastic surgery, and it's fat grafting, because with fat we can transfer fat now. We know how to do it, and it's a simple concept. You aspirate it, and you put a smaller needle on, and you inject it. But it's immensely more technical than that, and requiring much more skill. The Wright brothers airplane got off the ground because of lift and thrust. They had thrust by an engine, and they had lift by the wing that exercised Bernoulli's principle having to do with the relationship of pressure to the movement of molecules. So they had lift and thrust. Well, the F-35 uses lift and thrust. Mm-hmm. So the breast implant used silicone and silicone gel. Now, fat is not a wrist implant. So fat is it doesn't employ lift and thrust. It's nothing but thrust. And we inject this fat, but we have to follow a whole bunch of principles that Roger Currie has sought out and found and discovered and put together. And I've been with Roger for 3 years, 1 week a month for 3 years. And he had 3 operating rooms, and they were about as far as from here to that door over there. Mm-hmm. And his office was about where we're sitting, and I would sit down at 8 o'clock in the morning and start writing, and he would call me in about every 15 or 20 minutes. Look at this, look at this, look at this. Take a picture, take a picture, take a picture. And so all the pictures you see are my pictures that I've taken. And so that went on for 3 years. And he would do 15 cases a day, and sometimes up till midnight, after midnight even. I said, Roger, I love you, but I don't love you after midnight. Adios. Yeah. But we cranked out 4 papers that have been published in the last 12 months, and plus a book. And it's just been tremendously exciting. And exciting to see this evolve, because this has evolved too. Now we know the problem. The problem is too much interstitial pressure, or the problem is too much fat that doesn't allow the tiny little capillaries to feed them. So we've learned to use 2 millimeter molecules, and we've learned to not have any coalescence of fat, and we've learned to keep the interstitial pressure always below 10, preferably below 9. And so we use a manometer to do that. And all these things are step-by-step moments in the evolution of fat grafting, right, which I've been involved in. So it's very exciting.
Yeah, I think it's fantastic. And I want you to mention one of the things you're so Renaissance like with electronic media, which for me to change a password sometimes is a headache, but you have gone so far, and we talked about this before we started the interview, about the ability to watch the great people, great men, do a procedure and ask them questions, but you don't have to be there. Would you mention about what you're working on at this time?
All right, well, right now I'm working, okay, I have a colleague, Bertrand Lacotte, who lives in the Caribbean. And Bertrand's a very, very bright guy, well-trained plastic surgeon with Madeleine Lejeune in Belgium. And, but he doesn't have the international relationships that I have. And so he asked me a year or so ago, 2 years ago, if I would be a participant in a project he has. He has a website, he's created a website called eAesthetica, and he had an arm of eAesthetica of doing what we're doing, and I labeled it Videopedia. So it's Plastic Surgery Videopedia. It's a situation in which I find a super expert, for example, Roger Currie, and I get a video from Roger Currie of, in this case, a video I took, a video from Roger Currie of how he does his operation, or operations, because there are various aspects of breast surgery. And then before that, I interview him, just like you're interviewing me. And we talk for anywhere from 20 to 40 minutes, and just getting into the stuff that we want the public out there to see. And so then we put this together with a lot of pre-op and post-op pictures, and oftentimes there will be a postscript interview by me alone, taken in my own house with my own camera, with my own remote control, at which time I explain some little areas that I think need a little more explanation. Okay. And then we put that on the web, and it's available to any of our 16,500 legitimate plastic surgeons with addresses around the world. And they can access this video for 30 euros, and they have it themselves, they have a link to it, for 1 month, for 30 euros. So if you're living in Tierra del Fuego and you can't afford to go to Buenos Aires, or you're living in Eastern Siberia and you can't afford to go to Paris or London or Chicago or New York, you can get this video and have Roger Currie right on your shoulder for a month. Or you can have Patrick Tonard, or you can have Ruth Graf, or you can have Osvaldo Saldana, or you can have Carlos Weibel, or you can have any number of these people I've gotten, and we're going to get more. right next to you. So that's super exciting.
Well, that's fantastic. Now, next time I see you, you'll have something else to tell me you're doing. I think it's fantastic. I love it. I mean, it keeps us going, right?
Yeah, well, I've got some other new stuff.
What do you feel is your greatest professional accomplishment? You may have just mentioned 3, or might be something else.
That's a tough one, because one of my greatest professional accomplishments has been achieved through my travels. And I've had the great good fortune to have gone to 62 foreign countries and lecture, and many of them operate. And so those travel opportunities have given me a chance to meet people and to hear them and to understand them. And it caused me to create this phrase, the bonds that unite us are greater than the borders and the boundaries and the languages that divide us, because we're all seeking the same thing, and that's the betterment of the life of the patient through plastic surgery. So going to these 62 countries has allowed me to have so many experiences that I've learned so much about from plastic surgeons elsewhere. And then the greatest joy, I guess, is to have somebody like you say, I heard you 5 years ago say such and such. And I thought, wow, to have somebody remember what I said is really a joy.
Yeah.
And the second great joy is my residents. I've had 144 residents that have rotated with me, and then many visitors, of course. And to have these people out there and to have them call me up and ask me to help them with a project or something, wow, it's such a joy for me to be with somebody that's 20 or 30 or 40 years younger than I am, who's got a brain bigger than mine and an enthusiasm equal to or more than mine, and to work with them. And I've got several that I'm working with right now that we're really making great progress. But then the last thing, I think, is to be in Costco or the movie theater or some restaurant and have somebody come up and say, oh, Dr. Biggs, I'm so happy to see you. You operated on me 30 years ago, and it really did make my life better. And I almost get a tear in my eye when I tell you that.
It's a great story. Because
to have people say that, and I know you've heard that. You've got the same experience. Anybody who's been doing what we've done for so long has those experiences. That's why we're here. That's exactly why we're here. And so therefore it's worth it.
What do you feel is the greatest mistake we've made as a specialty?
As a specialty? I think 2 things. I think number one, we've been too worried about our turf. And so therefore we've made ourselves distant from other colleagues who are doing similar work in similar areas. And I'm thinking primarily of otolaryngology. Now, when I went to the Air Force in 64, I just had finished my residency, and this was a large hospital, Travis Air Force Base outside of San Francisco. And they had an oral surgeon who had been there for a number of years, and they had an otolaryngologist there. Well, to make a long story short, I learned a lot from this. I learned all about septoplasty from this otolaryngologist that I hadn't learned as a resident. I learned a whole lot about how to fix a broken jaw and how to get those wires on and off without agonizing pain. And I learned a lot about the mandible and the maxilla from this oral surgeon that I hadn't learned. So there are talents out there. There are men, honorable, ethical people who have things to offer. And I think that we've protected our turf so much that we've locked the door on this. And I'm happy to see that's changing. Now, I'm getting, in my plastic surgery videopedia, I'm going to get some of these people in there because I don't have any obligation to any of the societies. And I'm going to open those doors. Now, I don't want otolaryngologists doing breast augmentation. I don't, and they're not going to. But they know an awful lot of this facial plastic surgery that I think that we ought to know about.
Yeah. So
I think the mistake has been, that's number one. The second mistake, I think, is that I turn on the television and just about every week there's some theatrical society is giving some kind of an award, an Emmy award, a Tony award, or a Grammy award, or an Oscar. I think our society has been amiss in not picking out specific things that members of our society have done to enhance society, because I dare say our people are enhancing society more than they are. But they have capitalized on promoting individual members of their theatrical community. We could be promoting individual members of our community, not in a commercial way, but just let the folks back home know that Dr. Levine has done this, and it's a special thing. And get out in there and let the people who are watching TV and reading the papers know that there are plastic surgeons who are doing special things and are recognized by the society as such. So I think that's another mistake. There are a lot of other mistakes. But
I would like to know your greatest professional disappointment. Is that fair?
Well, the real truth is that I don't really know that I've been very disappointed.
Okay.
I'm disappointed that I wasn't wise enough to keep better records. I'm disappointed that I wasn't wise enough when we made the transition from slides to images, to digital images, that I wasn't more aggressive in keeping more, because I just kept this good case, and I didn't keep images of complications. And people say, "Well, show me a complication." Well, I didn't keep those images. I just didn't want to live with them anymore. Okay. So I'm a little disappointed I didn't keep better records. And Dr. DeBakey kept sensational records. And when I was his resident, what I would do is I would prepare a list, an individual sheet of what we did with each patient every day. And so when he walked out of the hospital after making his evening rounds, which was 7 or 8 o'clock at night, I was obligated to hand him those pages. He said, "I don't want to ask for them, you hand them to me." It was almost like a relay handoff. Mm-hmm. So I learned to put those pages in his hand as he was walking toward his car, because I would walk him to his car. As he was walking to his car, I had put those 10 or 15 pages in his hand. And I should have done something like that, but I didn't.
No. So tell me who you admire most, professional or personal?
Wow. There's so many people I admire, I couldn't begin to answer that. I think from a professional education point of view, certainly Michael DeBakey. He was constantly. One of the things I say is youth is the capacity to adapt to change. And if we don't change, we become stagnant. And the second thing is that the greatest opposition to progress is the comfort zone. Look, I've been doing it this way for 15 years. Don't tell me something new because I've been successful, my patients are happy. That's bad. Now, Michael DeBakey, number one. And then the second was Tom Cronin. Tom Cronin would go to a meeting and he'd come home, we'd start doing everything new. And we couldn't get a series of anything hardly because we were always changing our system. But he didn't have the comfort zone. He didn't fall back into a comfort zone. And then after Tom Cronin, of course, Mel Spira was 3 years ahead of me in the residency, which meant that he was working with me most, and he really taught me more how to operate than anybody. Mel Spira, he's here.
Yep.
And then after Mel Spira came a number of people that I've worked with very closely, Ruth Graff in Brazil and Ozan Sozer in El Paso and a number of others. But Roger Currie. Roger Currie, I'm speaking today, or tomorrow, on fat grafting to the breast, and it's all Roger Currie. And I say that Roger's the prophet, I'm the evangelist.
Okay.
But really, I can give Roger's work better than he can because I can say that Roger's a genius, and Roger can't say I'm a genius, but I can. He's a genius, and he's constantly changing, not big things, but little tweaks, because he's got the rocket. He's invented the rocket. Now he's making a better rocket every day.
Right. Okay. Would you give us your words of wisdom for future and present generations of plastic surgeons?
I think that people talk about, oh, plastic surgery is going to disappear because of these other specialties. Wrong. We are not a regional specialty. We are not genitourinary, we're not neurovascular, we're not cardiovascular, we're not bone and joint. We're innovational surgeons. Now, for example, the Nobel Prize, kidney transplant went to a plastic surgeon, okay? So we are innovational surgeons. So anywhere there's a place for innovation, that's us. That's how it all got started in World War I. That nobody knew how to handle these terrible facial injuries. So they got these bright guys together, and they, through innovation, started figuring out how to treat these terrible war injuries. So that's who we are. That's our family. That's our foundation. That's what our cause is. Innovation. So seek out new ways. Now, everything new is not good, but everything good was once new. So listen to everything, and then either accept it or don't put it in the trash. Just move it aside, and it may come back. So remain innovational. And if we remain innovational, we will not only survive, we will thrive. This fat grafting thing is going to be bigger than breast surgery. We're also now doing it with Dupotrons, and I can't wait for some orthopedist to call me and say, Tom, I've got this patient who's had 7 operations on his shoulder, and his shoulder is just all scarred down. Anything you can do? The answer is, yeah, we can do a lot. Yeah. We can go in there and we can take that scar that's like this, and with tiny little nicks in it, open it up and make it into a scaffold, into a matrix, and then fill that matrix with fat. They haven't asked me, but we can do that.
Yes.
And if we can do it with orthopedics, we can do it with gynecology, we can do it with general surgery. Wow, this is a door that's being opened to the whole world of surgery, all because of plastic surgery.
Okay. Yeah.
So we have a future. You betcha, baby, we got a future.
Okay, we've talked about this, and you are a testament to what I'm going to ask is the words of wisdom for retirement.
Well, I've just been so fortunate because I was involved with the Aesthetic Plastic Surgery Journal for 7 years, and then I got invited places, and smart people sort of asked me if I would give them some help with something, and I got into that, and so I've just been busy in my so-called retirement. How do you like retirement, Dr. Biggs? I don't know. I haven't experienced it yet. There is a downside. When you stop operating and you cease to be an operating plastic surgeon, your life changes because your identification of yourself is a little different. Mm-hmm. And to have to say to somebody, you see them at a party, Dr. Biggs, I want to come see you. Sorry, you got to go. That's unpleasant. But this doesn't last very long if you have something else to do. Something else that's not only gratifying, but something else that's satisfying some kind of need that you have, especially if it can make somebody else's life better. So seek it out and dedicate the same effort you dedicated to your practice to that effort. And retirement will be something that you don't even understand.
Well, that leads into the final question. Where do you see plastic surgery in a quarter of a century?
Bigger and better, because there's so many new things coming on that are going to enable us to do better and better and better work. The whole purpose of plastic surgery is to mold or make new. And goodness good, we got 3D printing, you know, and with the use of 3D printing, there's no telling what we might accomplish. And as we learn more and more about the autoimmunity situation, the immune mechanism, and how we can control that, then they're doing the hand transplant and the face transplant, things like that will become more and more commonplace. So there is a tremendous future, especially in plastic surgery, because it's innovational surgery, and we're not limited to a region.
And this brings me to my final question before I make final comments, but is there anything else you'd like to highlight? You think you've covered it all?
Well, no key fits every lock, and no one thing is good for everything. But the only other thing is that we're blessed. We're blessed because we've been given some kind of talent, and we were propelled into this specialty for probably of no purpose of our own. We just sort of happened to get into it, and so we were pushed into a certain area of work where our talents can be utilized. And so this is a blessing. I feel as if I've been blessed to be what I am. I can't imagine being anything else. I can't imagine doing any other kind of work. But we've been blessed, and therefore we have an obligation to turn that blessing around. And I think that's the main thing I could say if I wanted to say one last thing.